As we take a look at the eye, one of the things that we can discuss is not just the structures, but the spaces and the fluids that are found inside the eye. And so what we're going to be able to see is this model kind of helps illustrate some of the spaces and the fluids, with the exception of one. One of the unique things, as I said, is the eye is not just filled with air. It's just not just hanging out, and then we don't have like this, oh, we just kind of pump it up. Not at all. It's actually filled very solidly with this gelatinous kind of body. And you can kind of see we kind of divide the eye into two parts. Something what we call the posterior cavity and something what we call the anterior cavity. And the way you do this is by dividing it with the lens. So the lens is the dividing mark between what we call the posterior cavity, and then anything in front of the eye, or the lens, I'm sorry, is what we call the anterior cavity. The posterior cavity is filled with this large jelly-like fluid, which we call vitreous humor, or the vitreous body. You pull it out of an eyeball, it feels like just like a big snot ball. And so this is the vitreous body, and then anything on anterior, and this is not really changed too much. You know, you pretty much keep most of it. It doesn't really circulate. It just kind of gives the form of the eye, and that's why when you kind of pop an eyeball, it just like explodes because this helps keep its shape. But anything anterior, now we get to take a look at all these other additional structures. As we go anteriorly, these structures are clear and they need some type of nutrients and nourishment. But you can't use blood because blood is red, and you'll find that you won't be able to see anything if you flood this whole thing with blood. So what we do is we fill it with a blood filtrate, and we need a place to be able to circulate this. And so here we find two spaces. Well, first of all, remember that anything anterior to the lens, to the cornea, is what we call the anterior cavity. Now, we subdivide the anterior cavity into two chambers. Now, the way I like to remember is cavities are huge, big spaces, but chambers are like little rooms, and you're like, come to my chamber. And you're like, yes, I'm going to your room? Wait. So cavity is big, chambers are small, and so chambers are divided by the iris. If you can imagine, the lens to the cornea is the anterior cavity, but the lens to the iris, you can see this little small space here, is what we call the posterior chamber. Okay, posterior chamber. Anything anterior to the lens, or sorry, anything anterior to the iris to the cornea, this area is what we call the anterior chamber. So lens to the iris, posterior chamber, iris to the cornea is anterior chamber. And you'll find some fluids. The ciliary body actually produces this blood filtrate that kind of bays over the lens and the cornea as it pours out through the pupil and then drains into the canal schlemm. Something we call aqueous humor. And aqueous humor is constantly being used all the time. Fluids pumping out, pouring out through your pupil, draining, bathing, yum, and then drains right into the sclerovenous sinus or the canal schlemm at the limbus. And then voila, you get your living eye. If all of a sudden one of these things get clogged, you get glaucoma. And so glaucoma is the increased intraocular pressure because either you make too much aqueous humor or you can't drain away. Latter is more common. And so that's a problem because pressure on nerves is not good, and there's really nothing to allow for pressure in the eye except for the optic disc, where all of a sudden you'll herniate your optic disc and then kill off your optic nerve and you go blind, and that's bad. So let's review. Posterior, you divide into two spaces. The lens divided into a posterior cavity and the anterior cavity. Posterior cavity is filled with vitreous humor. Anterior cavity is subdivided into a posterior chamber behind the iris, and then the anterior chamber in front of it filled with aqueous humor, where it flows from the ciliary body out through the pupil and into the canal schlemm or sclerovenous sinus.